Ladies and gentlemen, distinguished colleagues, and fellow seekers of truth, today I stand before you not as a mere lecturer, but as a witness to one of the most insidious conspiracies of our age, a conspiracy not of shadowy cabals in smoke-filled rooms, but of corporate boardrooms, clinical white coats, and the quiet machinery of profit that has quietly redefined human suffering as a revenue stream. I speak of the pharmaceutical industry, Big Pharma, and its hidden alliance with the psychiatric establishment, a system that does not merely treat illness, but engineers it. They place false sicknesses and diseases before us, widen the boundaries of what counts as ill, and hope, yes, actively hope, we become dependent, chronic users of their chemical cocktails. This is no accident of capitalism gone awry. It is a calculated business model dressed in the language of healing, and it can be proven, point by documented point, through court records, leaked internal memos, peer-reviewed exposés, and the very data the industry itself has been forced to disclose. Let us begin with the core hidden agenda, disease-mongering, the deliberate expansion of diagnostic boundaries to transform healthy people, or those with mild, self-limiting complaints, into lifelong patients. As Australian journalist Ray Moynihan documented in the British Medical Journal in 2002, pharmaceutical companies do not simply sell drugs. They sponsor the very definition of diseases to expand markets. Osteoporosis was reframed from a risk factor in older women into a widespread disease requiring early intervention with drugs like Merck's products. Social phobia, once a personality quirk, became a million-person epidemic in Australia after Roche's PR firm promoted it to sell moclobemide. Premenstrual dysphoric disorder, PMDD, was rebranded from severe PMS to justify Serafem, fluoxetine repackaged. Female sexual dysfunction and even restless leg syndrome followed the same playbook. These are not fringe theories. They are detailed in Moynihan's seminal work, Selling Sickness, and corroborated in the Journal of the American Medical Association ethics articles on industry influence. The motive? Chronic conditions generate recurring revenue. A one-time cure ends the cash flow. Lifelong dependence, tolerance, withdrawal, polypharmacy ensures it. Internal industry documents, released through litigation and archived in the Drug Industry Document Archive, DIDA, reveal marketing plans that explicitly target healthy people who believe they are sick. One leaked memo from a medical communications firm outlined a 3-year campaign to make irritable bowel syndrome seem credible, common, and concrete. This is not medicine, this is market creation. The second hidden agenda is even darker. The pharmaceutical industry's structural incentive to keep us sick rather than heal us. As one investor report bluntly noted, curing patients is not a sustainable business model. Blockbuster drugs for heart disease, cholesterol, anxiety, and psychosis are designed for daily, indefinite use. Statin thresholds were lowered, turning millions with normal risk profiles into patients. Blood pressure guidelines created pre-hypertension. The opioid crisis offers the clearest proof. Purdue Pharma's internal documents, unsealed in multi-billion-dollar lawsuits, show executives knew OxyContin's addiction risk far exceeded their public claims of less than 1%. Yet they pushed pseudo-addiction as a reason to prescribe more, funded pain advocacy groups, and paid physicians for speaking gigs. Purdue made $35 billion from OxyContin alone. The Sackler family's wealth exploded while overdose deaths soared. This pattern repeats. Lawsuits against GlaxoSmithKline, Pfizer, and others for off-label promotion and kickbacks reveal a business model predicated on volume, not cure. They do not hide cures. They prioritize patent-protected chronic therapies. Why invest in eradication when dependency pays dividends? Now consider the doctors, the willing runners in this enterprise. Far from independent healers, they function as commissioned sales agents. Under the U.S. Open Payments Database, mandated by the Affordable Care Act and publicly searchable, over half of physicians have received industry money, meals, consulting fees, speaking honoraria, travel, totaling billions since 2013. Rigorous studies, including a 2020 synthesis of 36 analyses in Annals of Internal Medicine and ProPublica investigations, show a consistent causal link. Doctors who accept payments prescribe the paying company's drug 113 to 141% more often, depending on the medication. One analysis found payments tied to a specific drug increased prescriptions of that exact brand by 58% on average. In some systems, Taiwan pre-reform, certain U.S. oncology practices, physicians directly profited from dispensing markups, creating per-prescription incentives. Even where direct bonuses per pill are illegal under anti-kickback statutes, the effect is identical. Financial ties correlate with higher volume, higher cost prescribing. A 2020 National Bureau of Economic Research paper quantified it. Each industry payment boosts consumer prescription spending by about 4% the following year. Doctors are not corrupted by malice, but by a system that rewards volume over outcomes. They become the street-level distributors in a legalized narcotics trade. And then there is psychiatry, the crown jewel of this conspiracy, the domain where illness is manufactured with the least scientific grounding. Here, the pharmaceutical industry found its most fertile ground because, as Thomas Szasz argued in his 1961 book, The Myth of Mental Illness, psychiatric diagnoses are not diseases in the medical sense. They lack objective biomarkers, cellular pathology, or verifiable physiological lesions. The DSM, Psychiatry's Bible, is a committee-voted catalog of symptoms, not a laboratory-derived taxonomy. Szasz called it a metaphorical labeling of problems in living, a tool for social control rather than science. The Rosenhan experiment of 1973 proved the point with devastating clarity. 8 healthy pseudopatients presented with a single fabricated symptom, thud, empty, hollow auditory hallucinations, and were admitted to 12 hospitals with schizophrenia diagnoses. Once inside, they behaved normally. Staff still pathologized every action. Average stay, 19 days. Discharge required agreeing they were in remission, never sane. Though later scrutinized, the study's core finding on diagnostic unreliability endures in textbooks and was replicated in spirit by modern How Matter You investigations. Modern critiques in PMC articles and philosophy journals confirm inter-rater reliability for many DSM disorders remains poor. There is no blood test for depression, no scan that definitively diagnoses bipolar disorder. Yet antipsychotics, antidepressants, and anxiolytics generate billions in chronic prescriptions. The industry funds awareness campaigns, ghostwrites studies, and influences guideline panels. The result? Overdiagnosis, lifelong labeling, and chemical dependence sold as treatment. The psychiatric system cannot be trusted because its foundational claim that these are biological illnesses like diabetes rests on opinion, not replicated, falsifiable evidence. Szasz was right. It pathologizes deviance and normal distress to justify intervention. The untrustworthiness is structural. Stigma that follows diagnosis, coercive practices, and a revolving door with pharma that turns human variation into profit. In sum, the pharmaceutical industry is not a benevolent healer, but a legalized drug cartel. They call their products medicine while operating exactly as street dealers do. Create demand, ensure repeat business through dependence, and enlist runners, doctors with incentives. Their hope is not our health, but our sickness. Chronic, manageable, billable. The evidence is not hidden in conspiracy forums. It is in the BMJ port unsealed documents, open payments data, Szasz's writings, and Rosenhan's study, all findable with a search engine and a library card. The dark truth is this: we have been turned into patients, not because we are sicker than our ancestors, but because sickness is profitable. The question is no longer whether this conspiracy exists. The records prove it does. The question is what we, as informed citizens, will do to dismantle it, demand transparency, reject medicalization of normal life, and reclaim the boundary between genuine healing and corporate dependence. Thank you very much.